you started the quiz series for INI-CET PYQ. I used to appear for them since my third year only.
Oh.
So they were actually like quite helpful, like because most of my PYQs from Opthal were covered only in those Telegram quizzes itself. So yeah.
Oh, so nice of you. Yeah. So hello everyone, and we are here to celebrate the great success of Dr. Phalak, who has achieved a marvelous rank of 38 in the recent INI-CET. So first of all, heartiest congratulations, Phalak.
Thank you so much, ma'am.
So how are you feeling? Was it expected?
Ma'am, honestly speaking, I was like kind of expecting a good rank, but I was not expecting like with being in top 50. But still, it's kind of a shock, but also kind of like a relief as well. So
Yeah, I think it's a big relief and a pleasant,
yes,
pleasant relief. Okay.
yes, ma'am. Sure.
Okay, so Phalak, can you introduce yourself and tell us about your journey? How did you started?
Yes, ma'am. So, hello everyone. This is Phalak Dhaka, and I'm from MBBS batch 2017. I attend med school at AIMS Rishikesh campus, like the All India Institute of Medical Sciences Rishikesh. And right now, I'm in my internship, which is which is about to end in December. So I started my full-fledgedly. I started my preparation in at the beginning of third year, like that is at the time of COVID actually. So we were at our home for 9 months, so that actually kind of helped me to cover most of the content in my third year itself. So that was one of the plus points of holiday, that extended vacation, kind of.
Okay, so that was a blessing in disguise. You got more time for self-study,
Indeed, ma'am.
that means.
Indeed,
Okay.
ma'am.
Yeah. So I suppose you were an advanced package user. So how did you started your preparation, Phalak?
Yes, ma'am. So firstly, I used to cover the content from the videos, at least for the shorter subjects. And then then after completing content, then I used to read the textbooks. So that kind of helped me reinforcing the concepts which I learned from the videos. And notes, I actually didn't for the shorter subjects, I made my own notes, but for the larger subjects, I usually used to go through the printed notes only. So that was my mainly.
So, I mean, if you go with the videos and even use these notes, you can personalize those notes by
Yes, ma'am.
highlighting.
Exactly. So I could add on something if I used to find anything extra in the the Q bank and anything else which I used to think which was high yield. So yeah.
Okay. So how many hours, your study was qualitative or quantitative for everyday goals that you made?
Yes, ma'am. That's so that was because in third year, because we were at for a longer duration at our home due to the COVID situation which I described earlier. So I had a longer duration of I could manage to study for 6 to 7 hours at least in a day. But when I came back and we had our postings and our regular classes from 9 to 5, then it was kind of difficult to manage equal amount of hours, 6 or 7 hours per day. But at least I used to manage 3 to 4 hours. It was more focused on qualitative rather than the quantitative aspect. Rather than a number of hours, I used to the content I read, but that day rather than. So that was my thing.
Yeah. So you have qualified along with their internship, and we all know that internship is a hectic time. So Phalak, how did you manage both the things?
So, ma'am, it was I was one thing was that because I had completed my the syllabus once, at least in my by the time of my final year exam. So I only had to go through the notes only once, for the revision purposes, and I didn't need to watch the videos from scratch. And so I basically mainly focused on solving the Q bank. So that was my whenever I used to get time, I used to solve questions either it was through the Q bank, or either it was through the Telegram quiz which I mentioned, ma'am. So that was so that all helped.
All right. So I was discussing with the previous one also, because we all know that PYQs makes a big chunk in the preparation of INI-CET. So what percent you will say PYQs came in this INI-CET between 10 to 20, 20 to 30, 30 to 40, or 40 to 50, or even more if you want to choose?
So, ma'am, this time they already played a googly by having two shifts. So
but I
plus the
think most of
pattern.
the topics were same. They only had a slight twist in the question language.
Yes, ma'am. So like PYQs, I would say like at least 30 to 40 were like they were PYQs only, and not like just recent PYQs, but older, like even 14 and like 2014 and 13 papers were also PYQs from those papers also were there in the paper.
Yeah,
So like
so this I told in the classes also that previous 5 years MCQs are most important this time, and
yes, ma'am.
they did prove me right, because you know after 5 years the chances of getting repetition of the topic are very, very high.
Yes, ma'am. Exactly, I agree.
Yeah. So 30 to 40, you are choosing 30 to 40.
Yeah, ma'am. I could say that. Yes, ma'am.
Okay. So like even if when you were studying 6 to 7 hours, or when you were studying 3 to 4 hours, how did you manage? Means how did you divide it between theory and MCQs? How much time to theory and how much time to MCQs?
Okay, ma'am. So like my approach to preparation was mainly focused on like solving more and more MCQs. So I used to like so like because the MCQ, if I was solving MCQs, I was reading the explanation part thoroughly. So that was like kind of revising the theory only, na ma'am. So isliye I used to focus mainly on solving more and more MCQs. So that so that added up more and more. So rather than focus on theory, I was focusing more on MCQ part. So that was
all right. So MCQs also you used as a learning tool, as we always say that that is also a learning tool. So we learn through the MCQ. Okay. So like you started very early, as you told me. So how much contribution you will attribute that you started early and that's why you could make it along with your internship also?
So ma'am, like so it is kind of like starting early definitely helps. So it like, and plus like I was like mainly focused on getting the content for my like university exams mainly. So like plus like at our college we had a special pattern, like we had completely MCQ based pattern. So we had like no theory, like written exams. So we had to prepare everything full-fledgedly. So I had to solve MCQs early only. So that technically was a like a preparation for PG exams in that like so soon. So yeah.
All right. Acha, one more challenge that we face when we are preparing along with the internship, that we have to cross these prof exams also. So do you think that these Bhatia notes which you got, or the videos that you were seeing, they were enough for the prof exams too, or you have to prepare something separately?
Ma'am, they were like more than enough. Like I will say because when I used to study, like after going through the Bharatiya content, when I used to go through the textbooks, kind of it was like I had it didn't take much time to read the textbook. So it was like blessing, like it was a true benefit to actually like so I used to carry those notes around everywhere so that they came in handy. I could just go through those high yield points, and that would like help me solve more MCQs like that.
All right. So, which subjects, Phalak, do you think should be more focused for this INI-CET examination?
Okay, ma'am. So, like, I believe that mainly like they had the question, more content was like from the first year and the second year ones, like the basics of path, pharma, micro were like definitely like they were actually high yielding. Like those were my strong, like the subjects like patho, pharma, micro were my strong points. So that kind of helped me because they had more questions from those topics in the paper. The third year subjects like ENT, Opthal also were there, but they had like slightly the number was less. So I would say that anyone who's
How
like
many
preparing.
questions from Opthal, Phalak?
Ma'am, I would say at least like it was easily 7 to 8 questions that were there definitely. I
So
remember
I
them
think
clearly.
8 questions were there because I got total of 16 questions, maybe from 2 sessions, 8 each. So I would say 8 is a good number because earlier we used to get only 5 or 6. But now they have increased it to 8.
Ma'am, that was actually a surprise.
That was surprising. So dhire dhire Opthal bhi, and I think all subjects
Yes,
they are
ma'am.
increasing. Acha, how will you rate Opthal? How was it? Like AIMS people are known to give difficult Opthal or googly
Yes,
question
ma'am.
Opthal. So what is your experience this time?
So I'm this time around like when once I like I had gone through the paper of like May INICET, and the questions were actually very tricky. Like of ENT and Opthal, they were actually tricky. So I was
Last
like kind
time
of.
it was very tricky, yes.
So I was actually kind of this might, or this my time also they might be like doing the same thing, but the questions were actually like very like basic, and they were very easy to solve. So this time around Opthal was actually easy. So
It
luckily.
was a good one. Like
Yes,
Opthal
ma'am.
was scoring this time, I think.
Yes,
And
ma'am. Yes, ma'am.
all the questions, to my surprise, were there from the notes, and we had discussed them so
Exactly.
many times in the videos, in the notes, and in the last sessions also, right?
Yes, ma'am. Yes, ma'am.
Okay. So which subjects you liked most? Any
Okay,
faculties,
ma'am.
any people you would like to thank?
Mama, definitely one would be like not because you are taking my interview, but because I was actually a big fan of ophthalmology.
Oh,
Like people used to hate opthal in my class, but what
used
like
to,
there's so
yeah,
much.
they are hating, and
Yes, ma'am, they are.
they are hating of that because it is volatile. So,
But I actually personally like ENT opthal were like in third year I used to love ENT and opthal, and then from second year path pharma and micro were my like the favorite ones. I used to like the an art and physio part less, but these two, like these five subjects were like my main focus always. Like I used to enjoy them, enjoy reading them, enjoy solving more and more like questions from them. So like yeah, yes, ma'am.
okay, so you like these classes or these videos most?
Uh, I would like to like also mention like because I like I used to also like I also watched like Bhatia sir's medicine lectures, so like that also helped me in prof. So those like definitely medicine videos also. So yeah, yes, ma'am.
Sir's videos are really great.
Yes, ma'am. Yes, ma'am.
Yeah,
Especially like his book now, ma'am, that Mini Harrison, which we call like
yeah,
he
that is
has,
very good, very
that
high.
is actually very high yielding. Exactly, ma'am. That is
Yeah.
such a helpful book.
Yeah, so sir has worked very hard. He is a great
Yes,
fellow,
ma'am.
and not only me, I think many people are getting more and more
Yes,
motivated
ma'am.
from him. Okay,
Yes, ma'am.
so so what is that one thing that you think that is the major turnover in your preparation, which you will attribute most to your journey of success?
So ma'am, like one thing which I did was that I was actually the more and more tests and GTs I used to appear, like it helped me to like weigh down which topics were my weaknesses, and like it also helped me to actually get like a real time exposure also, and help me manage time in the final exam. So I started appearing for GTs well within the third year only. Like people actually kind of are scared to attempt the GTs, but I was like more and more GTs. So
Mhm.
that was one thing which I'll attribute
So
to.
how frequently you used to appear in the grand test?
Okay, ma'am. So, I mentioned earlier also that I bought the test series in final year. So, all those tests which were held like once a week, the subjective tests were being held once a week, or like so all I appeared for them as per the schedule, and the GTs which were they were like once a month. So, like I used to appear for them also. But then by the time like the November exam came, I was appearing for like two GTs per week, and then ultimately increased to three GTs per week, and then I used to review them again the next day. So yeah,
Three
that was that.
GTs per week.
Yeah, ma'am. And they were like some days, like even like I remember, like in the last 15 days, I was like not only from Bhatia, but I was like appearing for GTs from like anywhere I could like manage to
Okay.
go through a GT. I was appearing for GTs like per like in the last 15 days, it was one GT per day, like that. So yeah.
Okay. So how much importance do you give in reviewing the GT also?
Hmm. So, ma'am, firstly, the questions which I used to leave and the questions which were used to be like wrong. So I used to focus more on them, because the questions which are marked correct were like I was sure key, because I already was able to solve them in while giving the exam in the real time. So that I needn't put much time in. Although I used to go visit them again, but I used to focus more on the which I got incorrect. So that way I saved time in reviewing GT, because that is also a tricky thing to like review a GT again after appearing for it. So
Yes, because if you are giving GT so frequently, you have to manage
hmm,
the time judiciously. It
hmm.
is, I think you will agree with me that reviewing the GT is even more important than giving the GT. Otherwise, what is the
Yes, ma'am.
point of giving it? So, how much
Yes,
time
ma'am.
you used to give in reviewing the GT?
So I'm like, I used to like keep aside at least 2 hours for that, for reviewing the GT, and then like making the notes from those incorrect questions only. Like I wouldn't used to
20th
make any
notebook,
notes.
you also prepared that 20th notebook?
Ma'am, like it was like I didn't prepare a separate notebook. I only added the questions in the respective subject, wala, the notes and the notebooks.
Respective wala. Okay.
Hmm.
Okay, Phalak. So I will say amazing journey,
Thank you
very,
so much, ma'am.
very good score. Any piece of advice or important message that you would like to give to your colleagues or your juniors?
Ma'am, like only like two things which I would like to say. There's like it could be like more than two things, but like mainly to start early and to like solve more and more MCQs. Not, but that is not like the only sole purpose. Like it is not that only you solve MCQs. Definitely attend your postings well and gain those practical skills which are a must at least to become a good doctor. But still, to crack the exam, you need to have the like well-round. You need to be able to practice questions. So that was one thing, and also appear for GTs rather than being scared of them, tackle them head on. So yeah, that whole thing.
All right. So one, last piece of question. I think it's $1 million question. What did you do in your last 15 days?
Okay, ma'am. So I already like when I was like 45 days before the exam, I like used to wonder myself like what will I do. Then I asked some of my seniors like what they had done in their time. So they said that they were only doing the PYQs. They were like revising the entire content. But like so I also kind of planned to only go through the PYQs and the bookmark MCQs. I definitely couldn't do that. I will be very honest. So I only was able to go through the PYQ portions only, the Q banks and the only those PYQ topics only. But I wasn't able to go through the notes entirely. So yes, ma'am. Plus, I like on the last 2 days I actually did not study much. I was like only appearing for some small quizzes here and there, and otherwise I was like trying to remain calm before the exam. So.
Yeah, so I think this is also very important to remain calm and composed on the last day so that you can recall everything that you got
Yes,
in
ma'am.
your brain.
Yes, ma'am.
So perfect message with the awesome rank. Once again,
Thank you,
heartiest
ma'am.
congratulations from all of the team DBMCI.
Thank you
And
so much, ma'am.
we wish you all the very best for your future endeavors also.
Thank you so much, ma'am.
Thank you.
Shall I leave the video? Shall I leave the meet?
Yes. Thank you so much for your time.
Okay, thank you.